Achilles tendon is the biggest tendon in your body. It connects the calf muscles to the heel bone via the tendon, which can be prone to injuries. More recently, in the United States, pickleball has become popular and paddle in Europe and the UK, and we're seeing increasing amount of injuries to the Achilles tendon across a range of patients and ages. There are three common areas in Achilles tendon injuries. One being the insertion at the heel, where you get problems at the insertion. Midsubstance in the middle of the tendon, the thick part of the tendon that you can feel. And at the muscular tendinous junction, where the muscle, the calf muscle, connects to the tendon. They will present differently in terms of pain, symptoms and causes. The midsubstance Achilles tendonitis or tendinopathy is the most common condition. You generally develop swelling or a lump on the tendon at the middle of the back of the leg. Patients often get up in the morning with pain and they have a sense of tightness. They struggle returning to sports. This is very different to rupture of the Achilles tendon, which is an acute injury that suddenly happens in the middle of sport or activity, and people feel like they have a pop at the back of the leg and the tendon completely ruptures. The tendinitis or the tendinopathy is inflammation of the tendon and is caused by mostly chronic overuse. The underlying causes can be poor mechanics of the foot, poor footwear in a lot of cases, playing sports, or just general damage. If you do have Achilles tendon problems or tendinopathy, we have a range of treatments depending on the underlying cause. We will perform the necessary scans such as MRI scans or ultrasound to assess the health or the damage to the tendon. Treatments can include shockwave therapy, high volume injection of saline to reduce some of the inflammation and inflammatory components, as well as targeted rehabilitation and eccentric loading that we do with our physiotherapy teams. Surgery is not typically performed anymore for midsubstance Achilles tendinopathy. However, should you rupture your tendon, then this is a more acute injury, whilst conservative treatment in terms of using specialized boots can also work. In more athletic and younger patients, surgery may also have a place and may require urgent repair. The other common problem with Achilles tendon is insertion of Achilles pain. This can result in the back of the heel, at the base of the heel bone. People can develop calcific problems where they get calcification, hardening of the tendon. You may get an exostosis where there's a bone growth, or you develop bursa or a bursitis, which is an inflammatory sac causing pain. This can be assessed with X-rays, MRIs, ultrasound, depending on the right modality needed in your specific case. Treatments depend very much on the underlying cause. It may be shockwave therapy and occasionally surgery to remove any bone spurs, especially if there's chronic degeneration of tendon and large bone spurs. Sometimes we have to realign the heel bone, but often this is treated well conservatively with the right amount of rehabilitation and insoles and bracing techniques and modification of activity. The rarer conditions we see is muscular tendinous junction injuries. These are usually due to calf strains or acute injuries where there's tear or inflammation at the muscle and tendon juncture. This is again usually treated with rest, cast or boot immobilization and careful rehabilitation, and very occasionally surgery. If you have any Achilles tendon related problem, please contact us and we will assess you, diagnose you and help you to your rehabilitation.